this is a follow-up testimonial regarding a surgery that we did about a year ago. Just to refresh our memory, just tell me what were your symptoms? Tell me a little about your history. Specifically, I would like to know a little more detail about the surgery that you got in 2009.
That was an open fusion.
L4 to S1, the bottom two discs.
Yes, and they cut me open from the back and the front.
Yeah, do you remember the details of that surgery? How long were you in the hospital? How long this was the surgery?
The surgery was about, I think it was 10 or 12 hours.
10 or 12 hours,
Yep.
okay.
And I was in the hospital for a week.
Okay. So that was a two-level fusion that they went from the front, open up your belly, put the guts to the side, get to the front of the disc, and then they literally got the bad disc out, put a spacer in, and then they turned you and put screws in the back. I'll show it to you on the, and that it was a 12 hours, 10, 12 hour surgery and 1 week out. How were you after that surgery? How long did it take you to recover from that?
It took me a long time to recover, probably a good 6 to 8 months to recover after that one.
Okay. Now, you got better initially.
I did.
Okay, and then, but the pain came back.
Yep.
And we noticed that you have a problem 2 level above that level that you had the previous surgery. And we did the Olive procedure just about a year ago. And tell me about that surgery. What do you remember about that surgery?
I was in the hospital for about 24 hours and I went home.
Yeah. And you told me as well, when you woke up, you told your husband something about your leg pain.
Yep, the leg pain was gone.
Right away.
Yep, right away.
You woke up and the leg pain was gone after. Now, that surgery, I'm just looking at the data, we just looked together. It was a 52-minute surgery, and our blood loss was a little more than 100 cc, which was nothing. And you stayed in the hospital just less than a day. So, that was practically the same surgery that you got in 2009, 2-level fusion, but this was Olive procedure without that need to go through your belly or massacring literally muscle in your back. And that's because we spend much less time to damage the tissue to get in, obviously you recovered much faster. But when you went home, how did it go afterward? I mean, generally you said that you needed 6 to 8 months to recover from the first surgery. How long did you need to recover from this surgery?
Not very long. I was back working full time within 4 months of the surgery.
Yeah, okay, excellent. Well, I'm going to turn around and show your pictures. You got previous surgery, what we call ALIF, and they put what we call facet screws in the back. So it was the anterior and posterior surgery. This is the part that we did, which is literally equivalent of this surgery here, 2-level fusion. We did pedicle screws, which is stronger than facet screws, but facet screws are not super bad. They're good as well. They do what they are supposed to do. We see that you have a fusion already in the front. And more importantly, that everything is good, everything is growing. More importantly, how are you doing? We got a testimonial. You were doing pretty well a few months after this surgery. Now we are a year after this surgery. Are the results sustained? Are you still doing okay?
Yeah, I feel great.
Yeah, okay. Now you said you feel generally much better than you did before the surgery. But I think as well is important that you achieve the result much faster with much less initial pain and recovery time than that open surgery. Is that? Can you tell me about what could you do for 3 months or 4 months after this surgery that you couldn't do after the previous surgery? Just daily activities.
I was able to move more. I was able to walk around. I didn't have to use a walker for very long.
Okay. Return to work. How was it return to work after first surgery and the second surgery?
The first surgery, I didn't return to work for almost a year.
Okay.
And this one I returned to work within 4 or 5 months.
Excellent. Well, that's obviously significant improvement comparing to the old fashioned surgery. But any other question, comment, anything else you want to share with us? Otherwise?
Not right now.
Okay. Thank you so much. I appreciate that.